However, only 8 were in quarantine through their full infectious period. 19 spent part of their infectious period in the community, and we have 5 cases under early investigation. 10 people are hospitalised across the ACT, 2 in intensive care, 1 requiring ventilation. So we've seen through the pandemic that daily numbers can be volatile. These headline numbers are not what we wanted today. However, half of the cases are close household contacts, and that is the experience of this virus, that if someone catches it, they are highly likely to infect all of their household close contacts who are not fully vaccinated. There is a very high chance that if you get infected, the people who you will infect will be those closest to you. Now, having said that, the number of people infectious in the community is obviously very concerning. Our contact tracers are now going to have a very busy weekend. So what can we do now? Well, look, there are 3 things that we can all do to help the public health response. Get vaccinated, and we're seeing Canberrans come forward in large numbers. There are walk-in AstraZeneca appointments available. Please come forward for testing immediately you see any symptoms. One of the challenges and the reasons for people being infectious in the community, often for even just a day more than they should be, is that they're waiting to come forward for testing. So if you get any symptoms, please come forward to get tested immediately. And the third thing is to follow the public health directions. And that means wearing a properly fitted mask when you are out in the community, and to do everything that you can when you are out in the community to stay as far away from other people as possible. There have been no cases of transmission of the virus from people who are not near other people. The virus transmits when you're close to each other. Continuing to do these 3 things will go a long way to protecting yourself and those closest to you from the virus. And it will also make a substantial difference in the effectiveness of our public health response in the days, weeks and months that lie ahead. On testing, we had a little over 2,500 tests yesterday. Now, given the pretty ordinary weather today, some of our outdoor pop-up clinics may have to close. ACT Health social media will have the most up-to-date information on testing sites and wait times throughout the day. ACT Policing and Access Canberra and WorkSafe ACT continue a very strong compliance program across the territory. ACT Policing conducted 773 traffic stops yesterday, and only 3 directions to leave the ACT were required. Business compliance checks continue. Again, the themes and the common issues here are people not wearing masks properly and workers forgetting to check in at the site that they're working from. So just another reminder that the wearing of face masks is really, really important. But they're only worthwhile when you wear them properly. Having them not covering your nose and having them resting on under your chin renders them ineffective. So please wear a mask and wear it properly. Turning now to vaccination. Yesterday, the AIS mass vaccination clinic welcomed nearly 1,500 Canberrans, 1,451 to be precise, for a COVID vaccine. Now, this is going to increase the daily number very significantly in coming weeks as additional Pfizer supply is made available to the ACT. Now, in very good news, we've been advised that the ACT will receive 86,797 Pfizer doses from the Commonwealth's Pfizer swap with the United Kingdom. This is above our population share. The reason for this is that there is a rebalancing underway across Australia to see the jurisdictions that didn't receive their per capita share of the Poland million doses or the Singapore 500,000 doses are seeing that now made up in this 4 million swap from the United Kingdom. So this is great news for the ACT. We've been advised at National Cabinet yesterday that a significant number of these doses will be provided through our local GP network and pharmacies. Now, with the Pfizer supply increasing at GPs and pharmacies, we're also expecting pharmacies to start administering the TGA-approved Moderna vaccine. And with the announcement this morning that that will be available for people 12 years and older by the end of this month, there's going to be many more options available for people looking to get vaccinated sooner. So the ACT government is currently working on our plan to accelerate vaccinations in our mass clinics with these additional doses from the UK. They don't all arrive in one batch, they're going to be coming week by week, but this will be a welcome boost to our capacity to vaccinate more people more quickly. We'll make some further announcements on that in the new week ahead. Looking at the totality of our program now, though, we have 69.5% of the population aged 16 plus who now have a first dose. So we're going to hit the 70% first dose milestone over this weekend. And we are at 46% of the 16 plus population who are now fully vaccinated, noting the 2 to 3 week lag for the vaccines to become fully effective. The trend that we are seeing is that we will get above 80% of our population aged 12 years and over vaccinated. If you sign up for a first dose, you are highly likely to come back for a second dose, and across all of the age cohorts, we are very confident now that we'll go above 80% double dose for everyone 12 years and above in the ACT. This is still going to take several months, but adding in 87,000 new doses is the equivalent of about 10 to 12 days of vaccination. So it brings everything forward, and that is a welcome boost for our program. So for those who've joined late, a quick recap: 32 new cases, 24 of them linked, only 8 in quarantine during their entire infectious period, 19 infectious in the community, and that's the most concerning element for us now, 5 under investigation, 10 people hospitalised, and 2 being cared for by our magnificent staff at Canberra Hospital Intensive Care Unit. And again, our thoughts and our love go to those families who have loved ones in intensive care. It must be extremely, extremely difficult for you at the moment, but know that you have the love and support of this community. I'll now invite Dr. Coleman to provide an update on the new cases and the epidemiology. Minister for Health, Rachel Stephen-Smith, will then provide an update, and then all three of us will be available for questions. Thank you very much.
And good morning, everyone. Thank you very much, Chief Minister. As you know, my name's Karen Coleman. I'm the ACT Chief Health Officer. And just confirming, as the Chief Minister said, since our update yesterday, the ACT has recorded 32 new COVID-19 cases. This brings our total cases for the outbreak to 359. The good news is that a total of 120 of our cases for this outbreak have now recovered. So 48 more than yesterday, so 48 in the last 24 hours, which leaves us with 239 active cases. I know that this is a high number, and in fact, as the Chief has identified, I think it's our single highest number of confirmed cases in the ACT in a 24-hour period. But as we discussed yesterday and previously, I think, this can be indicative of a number of different things. And we actually still have a fair bit of work to get through today on these cases that have been notified to 8 p.m. last night. And just a reminder that while it is concerning, one high number on its own doesn't necessarily mean we will continue this trend upwards or that our system is not working. Our numbers will continue to fluctuate whilst there is transmission in our community. But what is really, really important is our ability to link these cases and quickly identify any potential for ongoing transmission or exposure to enable us to interrupt any further transmission. So we will be monitoring this over the next several days very, very closely, and this will be the important thing that we need to do. So some further detail of the new cases today. I can confirm that 24 of the 32 cases can be linked to either known cases or ongoing clusters. And out of those 24, 16 are household contacts. Out of the 32, only 8 were in quarantine during their whole infectious period. 5 remain under investigations as they came in quite late yesterday afternoon, but 19 did spend at least part of their infectious period in the community. We do have 10 people in our hospitals, and 2 of these are in ICU, with 1 requiring ventilation support. Our youngest hospitalised patient is under 16 years of age, and our oldest is 54 years. And just noting, I took a question yesterday about whether there are any cases in hospital associated or who are residents of Ainslie Village. I can confirm this morning that there are no COVID cases currently hospitalised that are considered residents of Ainslie Village. We now have just over 1,100 self-identified close contacts, so that number continues to fluctuate, and over 250 active exposure locations. But there will be more to come later this afternoon associated with our relatively increased number in cases today. So as I remind you every day, please continue to keep up to date with the current exposure locations on the ACT COVID-19 website. And if you've been to one of those identified locations, please follow our public health advice. So just talking to the wider outbreak, we are continuing to see our very slow movement to more cases in our 18 to 44 year age group. So we now have 55% of cases who are aged 18 to 44 years of age. We also continue to have 14 public sites of transmission. Notably, of our total new cases today, 6 are linked to our existing sites. So there's 1 new case linked to the Lennox Jaguar Land Rover dealership, bringing that particular cluster to 21 cases. And we have 5 new cases linked to the Bidfood Canberra cluster. This is 1 worker, but 4 household contacts. And this goes to the conversation yesterday about some of these cases in these clusters are actually household contacts, and we anticipate this. But this does bring this cluster to 9, noting that 2 of these are New South Wales residents and hence aren't included in the ACT numbers. I undertook yesterday to give you an update on our overall cases that we did not have a known source on. So of our total cases, 359, we are confident that 314 are linked in some way to our known clusters. But 37 are unlinked, and therefore we are not able to confirm how these cases identified their infection or acquired their infection. Our investigations are ongoing. This includes 8 of our new cases, which remain under early investigation, and these are ones that we have the best chance for identifying what their source of infection is. And as mentioned before, we still have a lot of work to do on these cases, and I'll be able to provide you with a bit more of an update tomorrow on the work we've done and where we're sitting tomorrow. But as I have said previously, we may actually never know the primary case for some of our clusters, and the more time that passes from the initial transmission, the harder that gets. But what is really important is that we know when there is onwards transmission from these cases, and our main goal is to stop this transmission. And the best way to do this is through quarantine. So I just want to take the time again to reiterate the importance of quarantine and what it means. So what we mean by quarantine, that is when we separate a person who has been exposed to COVID-19 from the rest of the community. So generally, this is because you've been identified as being exposed to COVID-19 either through being a close or casual contact of a known confirmed case, or you visited through one of the exposure locations. The amount of time that you are required to stay in quarantine is dependent on the level of potential exposure and whether there's a likely or a low risk of you becoming a positive case. That's when we talk about casual contacts or close contacts. But I cannot stress enough that if you return a positive result, you and all other people in your household must quarantine and follow the advice provided to you by ACT Health. This is how we prevent and reduce the ongoing transmission of COVID-19 to the community. Under our stay-at-home requirements, you should stay at home wherever possible and only leave for essential reasons. This isn't the same as being in quarantine. If you are in quarantine, you cannot leave your place of quarantine to exercise, to go to work, to go to school, to go to any public area such as shops, cafes and restaurants. You cannot have visitors. But if you are required to quarantine and need any support or assistance at all, please visit our website for information on support services. We have a range of things available, including health and wellbeing support and financial support. So let us know if there's something stopping you from staying home, and we'll do our level best to help you with that. But a little reminder that came up yesterday as well, if you are not safe at home, you can leave. If you are in immediate danger, call ACT Policing on 000. But if you do not feel safe in your own home, you do not need to stay. Please leave if you can do so safely. I do want to talk a little bit about the challenges that we have at the moment, rebalancing the movement of people in the community with the right level of restrictions to enable us to minimise that transmission, but also while supporting the health and wellbeing of our community, you guys out there now. Look, I acknowledge we may not always get this right. This is one of the hardest things that myself and all my colleague CHOs are doing over the last 18 months, and it will continue to be a challenge over the next 6 months as we work through this pathway. There are some very unique and individual circumstances out there, but we will constantly review the level of risk to our community and will adjust these settings as we need to. We know that lockdown is hard, and the intention of our recent amendments is to allow those who are really struggling or finding it difficult at the moment being separated from friends and family the opportunity to catch up and have that connection in a low risk setting when you need to. The intention of the changes we made for Friday is not for people to go out in the community and mix with as many people as you possibly can in a plan for a week during the lockdown period. You need to realise that the more people outside of your household that you come into contact with, the greater risk to both you and the people you come into contact with of you becoming a case or a close contact and the ongoing implications of that. Please use these amendments and these slight easing of restrictions as they were intended to support each other rather than look for loopholes and put your family and friends at risk. This is on all of us to continue to do the right thing. And just finally, my shout out today is actually to the Transport Canberra and Canberra Metro operations. We still have a lot of essential workers who have to get out and about for work, and people still need to do essential activities. So we need public transport out there. So thanks you guys for getting out there and providing that service to us. There's also a special shuttle service for the children of essential workers, and thank you so much to these guys for continuing to provide that. So my last reminder, please remember to wear a mask and check in if you are still using public transport at this time. I'll now hand over to Minister Stephen Smith to talk to you a little bit.
Thanks, Karen. I'm Rachel Stephen Smith, the ACT Minister for Health. And I just want to provide a very quick update on the Canberra Health Services and Calvary Public Hospital COVID Care at Home program, which is of course now monitoring a large number of positive patients at home across the ACT. This program is really important in helping to reduce anxiety among COVID-19 positive patients and their families by providing them with 24/7 channels for contact and to address any health concerns. The Care at Home nursing team checks in with patients regularly to discuss the management of any symptoms or any treatments that are being discussed with their doctors as well. Paediatric doctors and nurses are also part of this team to ensure the number of children across the territory with COVID-19 can be expertly cared for. If required, this team will manage those who deteriorate with an admission to the hospital in the home service or into hospital. The majority of COVID-19 patients who have been admitted to hospital in the ACT have been escalated through the COVID Care at Home program. And of course, we also have seen a number of patients who have come into hospital being discharged as well, but they continue to be cared for with the Care at Home team or through hospital in the home. This program is a great example of teamwork and collaboration with multiple services coordinating outpatient care for patients and households. So my shout out today is to all of those people working with the COVID Care at Home program, and of course to all of those patients and their families who are in isolation and quarantine and who are dealing with this disease, which we know can be quite challenging. Before I hand back to the Chief Minister, I just want to re-emphasise something that he spoke about a couple of days ago and came up yesterday as well. And that is a reminder to people to, even if you work in an essential setting, do not go to work if you have even the mildest of COVID-19 symptoms. Go and get tested. It may be that you are right, that you just have a cold, and then your test will come back negative. You should continue to isolate until your symptoms resolve. But it may be that your test comes back positive, and by going and getting tested, you have prevented the possibility of infecting your workmates, who will then take the disease home to their households and their families. So please, everyone who is working in essential work, your jobs are important. I know how easy it is to say it's just a cold and I'm going to go into work today. We all recognise that. But this is not the time to be making that decision. This is the time to be saying, I need to go and get tested. And if you need financial support as a result of that, financial support is available to you. We recognise particularly this is difficult for people in insecure work. But the price you pay if it ends up 3 days later when you do get tested and you are positive and you've infected your workmates is so much higher than the price of taking a day off work and isolating. And that financial support is available to you. So please, everybody bear that in mind. If you have cold and flu symptoms, don't go to work, get tested. With that, I'll hand back to the Chief Minister. Thank you.
Thank you, Rachel. Then we'll take questions.
Chief Minister, given you got an update at National Cabinet about some of the modelling and we've now seen an increase in people infectious in the community, what does the modelling show for the ACT about when we're going to hit a possible peak coming through?
Oh, right, okay. So the Doherty Institute modelling you're referring to?
Well, yeah, the Doherty Institute modelling, but also we've also seen some modelling out in New South Wales about when they're going to hit their peak, same with Victoria.
Okay, so the Doherty Institute modelling is a national model. It's not localised by state and territory. They have been commissioned to do some further work. In relation to the New South Wales modelling, that is obviously predicting what they've been publicly saying is a peak in their daily case numbers in this month, and then a peak in hospitalisation and ICU in October. The ACT position is considerably different from New South Wales and Victoria, but it is still too early in our outbreak to make any predictions on when things will peak. The difference for us is that our effective reproduction rate, that is the number of people that each new case infects on average, is less than 1. So our outbreak is being controlled and slowly reducing. New South Wales and Victoria both have effective reproduction rates above 1, which means that each new case infects more than one other person, which means their outbreak is in fact still increasing. So we would not anticipate, based on our current caseload and our current effective reproduction rate, to see our outbreak worsen on today's available data. So a couple of important statistics that it's worth following are also the active caseload. And because we've had so many recoveries, the number of active cases that we are dealing with today, even though we've added 32 overnight, is in fact less. It was in the mid-250s, now it is at 239, so it has come down a little.
Given that it's too early to model, I guess, some of where our peaks are going to be, are you confident that we're going to be able to end this lockdown in 2 weeks, or are we going to? Is it looking likely that we're going to have to extend it?
I'm just not in a position to speculate on 2 weeks hence, right at the moment.
Chief Minister, yesterday you said ahead of National Cabinet that you were wanting to argue the point about what people should be telling the public about what will happen when we reach those 70 and 80% vaccination targets. Did you get that point across?
Oh yes, very clearly, and I wasn't the only one making that point. Now, what will happen from here is that the Australian public can expect a further briefing, public briefing from the Doherty Institute, together with the Commonwealth's Chief Medical Officer and the Prime Minister to the nation in relation to that updated modelling. But that's a few weeks away, I understand, but that there will be, and this is important, and this is something that I think we all agree with, it's important that that revised modelling is made public.
At National Cabinet yesterday, I mean, it was discussed about what things could be rolled back at 70 and 80%. Given that your comments earlier about it would still need 2 to 3 weeks or so before the vaccine would fully kick in and everyone be fully immunised, where would that sort of leave the ACT and sort of what things might be able to happen once those targets are met, give or take a few weeks after that?
So that was a conversation that began but was not concluded. There was a lot of further work that was necessary in order to be able to give people the level of detail that your question is sort of inviting. National Cabinet's not meeting for another fortnight, so it's still several weeks away before there will be that level of detail.
Given the high case numbers today and more than half being infectious in the community, a couple of days back you were mentioning that COVID-0 is still a possibility in the ACT, not so much in Victoria and New South Wales. Do you still see COVID-0 as a possibility, even though we've seen record high numbers today?
Yeah. I think I point partly to my answer to Dominic's earlier question that it's not just the daily case numbers that are the important ones. It also includes, in terms of the modelling, the effective reproduction rate, the total number of active cases, the risk component associated with those who were infectious in the community, as in how many days and what was the nature of their community engagement. Now, the purpose of the lockdown, the purpose of the masks, the purpose of the physical distancing is all to have a range of other public health measures that protect against the risk associated with people being infectious in the community. And so all of those measures, together with the increased vaccination rate, all help, but they don't completely eliminate the risk. So that's the explanation. the short answer to your question is based on the current effective reproduction rate and the current caseload, which has actually come down a little in spite of today's numbers, it is still possible for this outbreak to be contained. But as I've responded to this exact same question on previous occasions, we still remain at risk from a further incursion. So whilst it is entirely appropriate and it is the correct public policy response to seek to address this outbreak, it doesn't mean that having done this, that we will be free of risk beyond this outbreak management period. We're only at a point when we are free of risk when we've got, or when it's even then, we're not going to be fully free of risk, but we will only be in a more comfortable position around easing the other tools in our toolkit, being the public health measures, once we've got our vaccination rate up very high. And again, you've not been at every press conference, so I appreciate that. But the three tools in the toolkit: vaccination, the public health measures, and the test, trace, isolate and quarantine. We've still got to use all three because our vaccination rate's not high enough. But as our vaccination rate gets higher, you can ease off, particularly on the public health social measures. But we're not anywhere near the vaccination rate we need to be able to do that at the moment.
Chief Minister,
Yes.
we've had reports from some parents trying to book their Year 12 student children in for the priority vaccinations that are beginning on Monday, that they've been waiting really long, excessive times on the phone. Is that an issue with staffing? And if so, is the government looking to expand at all?
No, so it's an issue with demand. Everyone tried to do it all at once, which is great. We're really pleased with the strong take-up, but so as bookings are made, that person is out. There's only a certain number in this cohort, and so we'll be able to work through. So my advice is, well, certainly apologies that everyone tried to do it at once, but that is a great sign actually, and that once people are booked in, they're no longer waiting in the queue, and it will be easier to make an appointment over the next 2 weeks now.
Chief Minister, we're just over 3 weeks into this lockdown of the 5 weeks currently. People are starting to struggle. We've had people bouncing around lockdowns from New South Wales, from Victoria and here. You've been asked about your risk appetite a few times, but since then we've had Victoria announce it's abandoning COVID zero, same with New South Wales, the numbers have soared. Can Canberrans expect some sort of roadmap that can provide a bit more certainty, given that you have constantly said that restrictions will not ease, there will not be a freedom day, even if lockdown comes out magically in 2 weeks? Is there some sort of certainty you can give businesses and Canberrans about how we're going to progress out of this?
Well, yes, in short, up to a point. So we are operating within the environment of the national plan, and that is being further refined in terms of the level of detail. You would be aware, Dominic, as you are a detailed follower of the fine print of the national plan, that there were a number of things that were highlighted, particularly in Phase B and Phase C at the 70% and 80% national thresholds that were still to be determined. And that's the work that National Cabinet is undertaking at the moment. So we will be participating both in that national process and our own, based on our own local epidemiology and the work that is occurring nationally. That work is the next couple of weeks. We've already been working on what our next step would be, but it needs to be based on certain checkpoints, where we are in our outbreak, what the risks are of moving to further ease restrictions. And so, again, I appreciate everyone wants to know exact dates. Unfortunately, the pandemic does not respond to either the community or my desire to be able to give an exact date on everything. It's a constant moving feast of challenges. And so I'd refer you to the statement I made yesterday at this press conference in terms of our approach going forward. I have covered this issue multiple times. As soon as we are in a position to provide some greater certainty on the short term, we will. Medium and longer term, still need to work through some national processes associated with National Cabinet. And in forecasting where things will be, it's a little bit like forecasting the weather. I can tell you that things are going to get better in terms of we have better weather in the summer. We're going to have a better COVID situation in the summer, but I can't give you the daily forecast for what's going to happen in October and November this early in September. But as we get closer, we'll be able to provide more information.
And will we need to strike a better balance between the current restrictions at the moment? We've got 2 hours of exercise, outdoor recreations are still closed. We're seeing mental health issues starting to spike. Does there need to be a better rebalancing between one, public health order and COVID, and then also the mental wellbeing and physical wellbeing of Canberrans?
I think Dr. Coleman spoke at length about this yesterday. I've addressed it multiple times as well. We are seeking to balance many competing priorities, and you've highlighted a number of them. But I was very clear that our number one priority is public health, because if we lose control of this outbreak, then the mental health consequences, the economic consequences, and the public health consequences are devastating. So it is really difficult now. But if this virus gets out massively in our community, life would be a lot worse than it is at the moment. And so that's what we are protecting against. I said at the start it's going to be a really tough spring. And we understand that. And we are doing our very best to make life easier whilst we're in this lockdown phase. And we are very conscious of the mental health, the economic consequences of public health directions. But it is abundantly clear from the experience of other Australian jurisdictions and globally that if you lose control of the virus in the community, all of those other things get significantly worse than they are right now.
Still quite a few months away, so maybe just your initial thoughts. If we do see international travel start back up between Sydney and overseas, do you have any thoughts about the possibility of that happening in Canberra as well?
As in flights out of Canberra Airport? Right. Well, I don't think Qantas are proposing to fly internationally out of Canberra Airport at this stage. We continue to be in touch with Singapore and Qatar, who were the airlines flying out of Canberra Airport previously, and we had been prior to the outbreak and when the Trans-Tasman bubble was open, working with Air New Zealand on New Zealand connections. That would all depend on which countries you would be flying to and presumably their COVID status as well. So you wouldn't rule out the possibility of there being flights out of Canberra Airport in December. But as my understanding of the date that Qantas has set for flying out of Sydney is the 20th of December, that week just before Christmas. So that can set some expectations. I'd say it's probably unlikely that between 20 December and 31 December that there'd be direct international flights out of Canberra Airport. So it's probably a 2022 possibility.
With the extra 90,000 or so vaccines that are coming over from the UK, what sort of time frame are we looking at in terms of the ACT getting them? You were saying it would be on a week-by-week basis, not all at once. Just how long would that be stretched over for?
Sure. So my understanding is that the first shipment leaves the UK this weekend. So presumably coming via Singapore or the Middle East. So 24 hours for that transit. So it would arrive in Australia over the weekend. Would then, my understanding is the TGA then does a batch testing to ensure the safety of the vaccines. Then they are distributed from their point of arrival to the states and territories. So I wouldn't anticipate those doses arriving in Canberra until towards the end of next week. And then if it's a weekly dispatch, which is largely how the vaccination process has operated to date, then it would be each week through the month of September. The point the Prime Minister made in National Cabinet was that these doses, together with the Singapore 500,000 that were allocated, and then the Poland ones, was that all of that was being summed as the additional and then rebalanced, as I mentioned in my opening remarks, because people may recall that New South Wales got a significant overpopulation share allocation early on last month, and they were able to bring forward some of their Pfizer supply to meet that immediate challenge in Sydney. But it was always anticipated, and it's great to see this confirmed, that there would then, that bring forward would later be offset, and that the rest of the country would then get back to its population share, because we do have to vaccinate the nation, not just New South Wales. So it is great news, but it's going to be week by week through September.
Has there been any other further discussions about people who have got the AstraZeneca vaccine and potentially getting their second dose sooner, more in line with what has been happening in Victoria and New South Wales as their situation has deteriorated?
Yeah. So that issue is one that is under consideration. The reason that it's at 3 months is a good reason in terms of vaccine efficacy, but other jurisdictions have made the decision to bring that forward somewhat. Again, I'm not a vaccine expert, but my understanding is that there is, a degree of clinical advice about the 9 to 12 week range, and then there's some research that talks about 4 to 8 weeks, and so you wouldn't bring AstraZeneca forward, I think, more than to a 4 week dosing interval, and that's probably not the optimal for that particular vaccine. So it is being considered. Other jurisdictions have made that move, but it's obviously an issue that requires a firm
liaison with your Queensland counterpart about discussions with regards to people under the age of 12, vaccinating that, and whether they're included in that population count?
Sure. So, So we had a really productive and I think useful discussion in National Cabinet yesterday about where global research is on under 12s. The US are conducting, as I mentioned yesterday, some clinical trials with particular vaccines. It still remains my understanding at this point that there isn't a vaccine that has received regulatory approval for under 12s, but that may come. And if it does, then it would be one of the vaccines that would be available in Australia, but that approval hasn't come through. The clinical trials haven't yet concluded, but that work is underway. So I think it is an important message for the community to know that this work is occurring. It's occurring internationally and within Australia, and that kids are not forgotten, and that the risk to kids of COVID is not minimised, is not being minimised by politicians, that National Cabinet does take it seriously, and we are looking at this. But the point remains that we don't yet have an approved vaccine for under 12s. And so in terms of the 70 and 80% thresholds, and principally the one to work towards, as I've been saying, is the 80% threshold, that would not include under 12s. I think it's still a live debate about whether it should include 12 plus as a result of there being now both Moderna and Pfizer approved for use for 12 plus. The difference in the ACT is that would mean adding about another 20 to 25,000 kids of that age into our total population count. So rather than working towards vaccinating 343,000 people, it would be about 365 to 370,000. The difference in terms of time could be as short as a couple of weeks. between hitting 80% 16 plus versus hitting 80% 12 plus. So I would argue that if Moderna is available and approved, and Pfizer is available and approved in increased quantities, then it is worth spending those 2 weeks to vaccinate those teenagers and 12 plus, between 12 and 15. That would be a very worthy public health goal, not just for our community but for the nation. And I hope that that's where we land as a nation. It's certainly where we're going to land as a territory.
We're getting some comments coming through about that tough spring comment. We understand that the 70 and 80% milestone won't be reached till about mid-November. In between, while some restrictions may or may not ease depending on the situation, will the bedrock of our restrictions be some sort of stay-at-home orders?
Dominic, I just can't speculate on that at the moment. It will depend on the number of cases in the community. If we ease restrictions too early and our cases spike, we'd have to go back into a hard lockdown. That's, I don't think, where anyone wants to be. So I would like to be able to take good, meaningful steps forward over the next few months as we continue to vaccinate. That would be the ideal situation. But that really is contingent upon continuing to vaccinate at an accelerating rate, effective test, trace, isolate and quarantine, and having some continuing public health measures in place. And I would draw people's attention to the detail of the Doherty modelling that's publicly available, the phase 1 work, and the detail of the national plan to point out that even through 70 and 80%, that there is still a requirement for some public health restrictions. That even past 80%, phase C, the vaccine consolidation phase of the national plan, minimum ongoing baseline restrictions, highly targeted lockdowns, it's still part of the public health toolkit, even at 80%, in black and white in the national plan. The national plan, when you read the detail, is a very good plan. The problem is too many people gloss over the detail.
Chief Minister, with some of those latest exposure sites identified, there are a number in Narrabundah. Are you at all concerned, considering the high Indigenous population in that area?
I'm concerned about any new exposure sites and about risk for the community. And so we want to be minimising the number of people infectious in the community and to have as few new exposure sites as possible. On Indigenous vaccination within the ACT, we have seen a really strong take-up from Aboriginal and Torres Strait Islander people over 60 years of age. We have the median age of the Aboriginal and Torres Strait Islander community in the ACT is about 11 years younger than the average, the median age for the Canberra population, which is about 35, and the median age for Aboriginal and Torres Strait Islander Canberrans is 24. And so there's many, many more younger Aboriginal and Torres Strait Islander people. Now, they are getting access to vaccination through a range of different channels, but the more vaccine supply we have, Pfizer and Moderna, means we can continue to lift the rate of Aboriginal and Torres Strait Islander vaccination in the ACT. Now, it's very, very high, in the 90% range at least for over 60s, and it's in the mid-50s, as I understand, for first dose for under 60. And so we continue to work through a number of targeted programs, as well as the general vaccination rollout to vaccinate more people. Questions for Dr. Coleman? Gone to AHPPC. Questions for Minister Stephen Smith? None? Okay, thank you very much.